Hi everyone. Did you know that 30% of the Canadian population is going to suffer with neck pain at some point in time over the next year? My name is Dr. Silvester from Grace Chiropractic, and neck pain is one of the most common things that I see as a chiropractor. So what I want to do in this short video is I just want to share with you the biggest mistake that people are making in terms of what is causing neck pain, and I want to give you some simple strategies that you can employ that are going to help reduce or eliminate neck pain as well. And the first thing I want you to understand is that the vast majority of cases of neck pain are directly related to your posture and to your alignment. And what I mean by that is that when you look at the neck from the side, I should see a nice smooth C-shaped curve when I look at your neck from the side. This is actually a lateral or a side view x-ray of a neck from the side. So what that means is that if you were to look right through the left side of my neck as I'm facing in this direction, you should see that there's a nice curve in your neck like this. And as chiropractors, we measure that. This is actually a 40-degree curve. And the nice thing about it is that when the curve is there, there's no undue stress on your neck, and the spinal cord and the nerve roots are completely relaxed on the inside. But here's the problem. Many of the folks that I see coming into the office, they don't have this normal posture where their head is over their shoulders. I see folks that more often look like this right here. And you can see in this x-ray right here, instead of there being a nice curve here, the head is shifted straight and forward. Essentially, the head is way out in front like this. So what that's doing on the inside, it's taking the neck and it's shifting it way forward like this. And the first thing I want you to understand, there's two bad things that happen, but the first one is that your head weighs about 12 pounds, 10 to 12 pounds they say. And the research shows that for every 1 inch that your head shifts forward, it's the equivalent of your head weighing an additional 10 pounds. So if your head is shifted 3 inches further forward, that's like your head weighing 30 pounds more. It's like having a 42-pound weight sitting on your neck. And you can well imagine what that's going to do to the nerves and the muscles and the joints and the discs. Of course, it's going to cause pain over time. But on top of that, the other concern is this. As your head shifts further and further forward, it puts stress on the spinal cord. And there was a neurosurgeon by the name of Dr. Alf Brieg that showed if you have forward head posture, it can stretch your spinal cord out anywhere from 5 to 7 centimeters up to 2 inches. And when you put pressure on the spinal cord, not only neck pain, you can get headaches, it can interfere with your breathing, your digestion, your energy levels, a whole bunch of things can be affected by that as well. So the biggest mistake that I see folks making that are actually causing this forward head posture has to do with the position that we're putting our neck in for large portions of our day. And many of the folks that I see nowadays are spending a lot of time on their smartphone, on their devices, and they're doing it with their head forward and their head down. I see folks that are office workers that spend a lot of time on the computer. I've got folks that are, spending a lot of time reading or knitting or even poor sleeping posture. I see folks that sleep in a fetal position with their head curled down or with too many pillows behind their head that are all driving the head forward and down. So the first thing that we need to do is to become aware of those postures that we're doing and do everything that we can to elevate the head. If you're texting, to keep the head up, the chin up. And the other thing that we want to do is not only eliminate those things that are causing the head to go forward and the head to go down, but there's some simple exercises. I want to give you 3 strategies that we recommend to our patients in our office. The first one is a very simple extension exercise whereby you can extend or tip the head back and you can put your hands on your forehead and gently put some pressure down and back toward the floor. And what that essentially does is it takes that forward head posture, pulls the head back, and starts to put some of that curve back. So that's one exercise. I recommend that patients hold that exercise 10 or 15 seconds at a time, repeat it 3 or 4 times in a row, and do that exercise several times throughout the day. The other exercise that I give patients with forward head posture is something called a chin tuck exercise, where you start with the chin elevated and you simply work on retracting or pulling the head back. Because for so many people, their head's in the opposite position, it's forward. And this is what is called a mirror image exercise, where you're pulling the head back. And again, I recommend holding that exercise 10 or 15 seconds, repeating 3 or 4 times in a row, and doing that multiple times throughout the day. The other thing that we use that's very, very effective in our office that complements the chiropractic care that folks are getting is something called a Deneroll, which is a neck orthotic. And these devices are fantastic for patients that have neck pain. It's very good at restoring the curve. And essentially what patients do is they lay on these devices We put them under the neck area to help restore that curve. In the beginning, patients lay on these for 3 or 4 minutes and they slowly build up to 20 minutes. And over time, we can get that curve back. And this is the take home from this video, is that if we can get that curve back into your neck, you would be amazed at how your neck pain is going to disappear. Until that time, it doesn't matter what you're doing. It doesn't matter if you're taking Tylenol or Advil or doing acupuncture or you've got Dr. Ho, whatever it is you're doing. The key has to be in restoring that posture, because until you do that, it's going to be an uphill battle with neck pain. So I hope that you found this short video valuable. If you have, I'd ask that you click on the like button below and that you share it with friends. Also, you could tag someone that you feel could benefit from this information as well. Lastly, if you want more information, please feel free to visit our website. It's gracechiropractic.ca. And if you want to post a comment, I'll be sure to get back to you with any information that I can to help you out. Again, I'm Dr. Tim Silvester, and I hope you have a great day. Bye for now.